and I'll answer them for you. But what we might start with is section 1. So we've got legal and ethical considerations for blood collection and how these are applied in organisations. You are working in a collection centre as a trainee collector when a baby is brought in for blood collection. Briefly explain your course of action in relation to the collection, including your answers, your duty of care requirements, and gaining consent for the procedure. So no matter where you eventually go to work, there is always company policies and procedures to follow. So you need to check those out and find out what their company policy is in relation to collecting babies. As a trainee, you would not be expected to be collecting babies for at least 12 months, and you would be signed off as competent within that workplace as well. So all you would have to do if you did have somebody bring in a paediatric for you to collect, all you have to do is seek assistance from your colleague. Never attempt to do it, but certainly observe as much as you can and learn from those observations. With heel pricks, think about a child and them at walking age and why you would not do a heel prick on a baby at walking age. Think about what could happen if you did the heel prick on a child's foot and they were running around, a toddler. So think about what issues could occur, excessive bleeding, infection, those sorts of things. When we're gaining consent, it is always a verbal consent. So we need to include in that consent what the procedure entails, so what's about to happen. So things like level of discomfort. How would you expect the patient to be positioned? What's expected of the patient? What equipment you're going to use? All those sorts of things. And explain the patient's rights throughout the procedure. Always go back and double check that the patient does understand what you are saying. And we have to ensure that it is verbal. It is a verbal consent always. Think about pediatrics, toddlers and children, how we're going to get that consent from them. So we need to look at the parents, gaining a consent from the parents, carers. Okay, section 2. The most effective form of infection control. Most definitely is hand washing. We want 3 examples of PPE, and I'm looking for a purpose of each item. So I'm looking for gloves, gowns and goggles. So I want you to be able to elaborate further on that and give me what purpose we would use those things for. Lancets are what is used to do a heel prick or a finger prick, and in relation to disposing, it is no different to a venipuncture. It is a sharp, so we have to treat it accordingly. There is two different types of capillary collections, and as I've just said, we have a finger and a heel. If you can keep in mind that a capillary collection is furthest away from the heart, so finger and heel. If you can do some research on a heel prick for a pediatric, for a baby, the correct surface site is the lateral or plantar surface of the heel. If you can do some research before you come to face-to-face and have a look at what that, where that is, that would be beneficial for you. It is policy to only collect in that area. The other areas contain nerves and tendons and bone, so you have to be really careful. So that is definitely the only area that you can use. Okay, so we go to E, briefly explain why clinical history such as fasting and non-fasting medications and dosages and time should be documented on the request form. If we think about clinical history affecting test results, so there's lots of clinical history that affects test results. It could be whether the patient's male or female, what time of day the test is actually taken. So whether they're fasting or non-fasting, all those medications actually affect, and dosages affect the results hugely. And then we go to briefly explain why you would choose to do a capillary collection over a venous collection. A venous collection is the preferred collection because we minimize the risk of hemolyzing the blood, but there are instances where there is difficult vein access, where patients have burns or scarring. Patients have very fragile or superficial veins, so very close to the surface of the skin. And patients that are on IV therapy and there's no access. So if the patient's in hospital and they've got an IV in both arms, you cannot do a venous collection from that area because the actual IV, whatever's in that IV, is running through the blood, and so therefore it does affect the test results. When would we choose not to do a capillary collection? Dehydrated patients, where there's large volumes of blood required. If the doctor's ordered, 10 to 15 tests, there is no way you're going to get that from a capillary collection. And if the patient has poor circulation, so where the blood isn't flowing adequately to those areas, to either the feet or the fingers. Okay, section 4. List 3 considerations for a blood collection procedure when choosing the site and device for skin puncture. We look at the patient's age, the volume of blood required, and how accessible they are. We would avoid using the index finger because the index finger is more likely to be calloused and more sensitive due to additional nerve endings. We'd also avoid using the thumb, the same as when we're palpating for a vein. We would avoid using the thumb due to it having a pulse and indicating arterial presence. In small babies, how far below the skin surface is the heel bone? It's around about 2 millimeters. With those lancets on babies, they're mostly called a tenderfoot. And the tenderfoot is actually a gauged lancet, so it doesn't go in any further than it should. It is the safest way to collect from a heel prick on a child. And as we spoke about before, if the central area of a child's foot was punctured, we risk damage to the tendons, nerves, and the cartilage. Is there any questions so far? Okay, section 5. Think about how we would identify a child that was brought into the collection room for a heel prick. So they would come in with a parent or a guardian, so those questions are answered by the parent or guardian. To get a really good viable sample when performing a capillary collection, we avoid squeezing the area, the site. We don't milk the site, we just encourage the blood flow. We allow the site to air dry following the cleaning with an Alco wipe. And it's really great to warm the site before you actually collect and just increase blood flow with the warmth. It's also a good idea if you were doing a baby to have baby up over the shoulder and the baby's legs hanging down, not laying down if you were in the maternity ward collecting, you wouldn't have the baby laying in the bassinet while you were trying to collect. Always up vertically over either mum's shoulder or another nurse or another collector, and it just encourages blood flow. So if we chose the incorrect lancet, you are going to risk injury to your patient, and you're going to have a poor specimen quality due to the slow collection. And every time there is a poor specimen quality, we run the risk of having the sample rejected because it can't be run on the analyzers. Okay, so we come to trough levels. So a trough level is collected just prior to the patient's next dose of medication or 6 hours after the initial dose, when a medication is in the body at its lowest form. And then we have peak level, which is the highest level of concentration of a drug medication in the blood system, which would be collected around about 30 to 60 minutes after the dose. Fasting is normally around about 8 to 12 hours, and it's a good idea to ask your patients to come in early morning to have their bloods done. The longer they leave it throughout the day does affect the test results. We also encourage our patients who are fasting to drink water. We need the veins hydrated. It's not a, unless it states nil by mouth, then a fasting test, it's okay to drink water. Okay. So after we clean the site with an alco wipe, it's allowed to air dry. Performing a collection through a residual alcohol can cause the blood to hemolyse, affecting results. And when it hemolyses, all the red blood cells break down, and it's not a viable sample to run on the analyzer. So it doesn't give exact results, which is not what we're looking for. Briefly explain why it's best practice to wipe the first drop of blood away with a sterile gauze, and it minimises infection, and it also allows for any of the tissue. When you're doing a baby heel prick, it's there's lots of little fatty tissue in there, so, and those cells can come out with the blood, so we wipe that away first up, and allows you go from there from the second drop of blood. We want to collect those specimens quickly due to the fact that if it is a slow collection, the samples will clot and they'll hemolyse, and therefore they can't be used. The containers, if they aren't filled to the correct fill lines, they do have a higher concentration of additives. So there is fill marks, even on the little pediatric tubes, there is fill marks that you are required to fill to. And as I said before, briefly explain what excessive squeezing may cause, and that's hemolysis. We always use the lancets or blades with a retractable feature. It is policy to use those, and it is a violation if you're not using them. So we have the lancet, and it has a little retractable blade there, and it is gauged, and all you do is rest that on the skin and press the button, and it does it for you. So they're quite simple to use, and you'll get to see those in your face-to-face training. Capillary collections you'll come familiar with in class, and also the tubes, and they are just a smaller version of the larger tubes. They're little pediatric tubes, and they have the same colors as the other tubes, so very similar, just a very minute version. Dressings with a capillary collection is exactly the same as a venipuncture collection. We still apply pressure for the same amount of time and apply our dressings. Labelling of the micro collection tubes is exactly the same as your venipuncture, so immediately following the collection while the patient is still with you. Blood samples, unless it's stated that they're room temp or to be frozen immediately, but normal blood samples, regular blood samples, are normally put into a fridge or an esky just to keep them away from the heat, because heat does affect them. So we've got incorrect packing of samples for transport can cause leakage, degeneration of the sample, and possible hazard to the carrier. How does this affect the patient? Think about if anything does happen to that sample, how that does affect the patient. If the sample is, if it leaks, an easy one is to think of a urine sample. If that sample isn't packaged correctly and it leaked out into the bag, we can't pour it from the bag back into the jar. So it becomes a recollect. So think of the inconvenience that can cause to the patient, and that goes for all samples. Micro containers are exactly the same as the larger tubes, so they do require to centrifuging if that's a part of the processing for that tube or that test. So exactly the same. Samples which you will get to do in class, you will get to operate the centrifuge. There's centrifuge for 10 minutes at 3,000 revs per minute. So depending on the company that supplies the tubes, which company your workplace is buying the tubes from, but generally they're 10 minutes they're centrifuge for, unless it's in your manual that they might have to be double spun or triple spun or spun for longer, but your manual would tell you that. Inverting of tubes is always done directly after collecting and before labelling. Inverting tubes is so that each tube has an additive, so that we can mix those additives with the blood and get the blood additive ratio correct to allow for correct results. Okay, any questions so far? There is a slightly different order of draw for your capillary collections. So what I'd like you to do is research capillary order of draw and see how that differs slightly. Always remember that blood cultures in your order of draw are always first. Okay, any questions at all? Okay, I'd like to move on and discuss briefly work placement. So once you've completed your face-to-face, you will be coming to work placement with New South Wales Health Pathology, previously known as Pathology North. You will be completing 35 hours. So I'd like you to think about your blocks. It is preferable that you do a 1-week block, if at all possible. I've found that it is really beneficial for the student. When in the past, we've had some students that have come a couple of days a week, and I understand that there's issues with family and work roles, but it actually is more beneficial for you to be more continuous throughout a week, and you'll find that you'll be a lot more confident. So we normally run our work placement with the first day you would be working in the lab. So you would be working in the SRA department, which is your specimen reception area. So you would be processing samples that come through from emergency department, wards, clinics from outside the hospital, collection rooms, and so therefore you'd get to see all the tubes coming through, all the tests, you'd be labelling, you'd be rejecting samples and that sort of thing, which I find is really good before you actually start collecting, because you get a really good grasp of what tests go in what tubes and how they're processed and all that sort of thing. You'll also be doing which is called the SMART, which is Specimen Management Area. That area is where the samples are aliquoted off and centrifuged and packaged or sent down to the analyzers within the lab, or some are sent off to other labs. So that's an area that you'll also be working in as well. The following day, you will start your collections, and you will start your live bleeds. And once confident, and once I've are confident that you have your technique correct, then you will start collecting in the collection room with assistants, and then you go up onto the wards and you start collecting on the wards with assistants. I'd just like to say that you need to be professional when you come into the workplace as far as your dress. So just wear your closed-in shoes for OH&S and have your a uniform on that you would wear to work. So whether it's a skirt and a blouse or pants and shirt, or just looking professional, and keeping in mind that when you are collecting the patients, you are the first face that they see in relation to the company. So you are pretty much the face of the company. Yeah, so if you have long hair, See if you can wear it up, which is off your face, and wear that up in a ponytail or a bun or however you normally wear it. There are some rules as far as nail polish goes, false nails and jewellery. So not a great deal of jewellery, no nail polish and false nails, because they do harbour bacteria. So that is an issue. And yeah, and so looking forward to seeing you all in class and then in work placement, which their previous students in the past have found it really beneficial and have really enjoyed it. And just when you do get to just start working on a resume now and getting your resume updated for once you arrive in work placement. Debbie, normally in the past we've had it where one student has started and then the other one starts a couple of days later. I'm not saying it's not possible, but you really need that one-on-one on your first day and your last day. So it is preferable to do at one at a time, but yeah, I'm sure we can look at that and see what we can do. Sharon, we do have we will be making up a roster, and that will go out, and then if it's agreeable, those times are agreeable, and the dates that are given, if you do have a preference, can you please forward it to me in class? So think about that when we get to class. If you can have that ready, then that would be good, so that we can look at that and factor those issues in. So most work placement days, it's beneficial for you to start at 8 a.m. purely because that's what time the collectors do start, and they're the busiest time of the morning, so that you're going to get that, it's more beneficial for you to see what's going on, and to be able to, you have to get up your 15 collections. So it is preferable that you do start at 8. The wards start at 8 and the collection room starts at 8. So work placement days will start at 8 o'clock.
Hi girls, you just got Sarah here. So what we'll do, sorry to cut you off, Lisa. What we'll
That's
do in
right.
terms of work placement is that after you've attended your first workshop, us here, the Allied Health team, will probably we'll send out a bit of a list and we'll just ask any blocks of time that you're not available. For example, if you can't get childcare over school holidays or if you have a holiday booked in, and then we'll give that to Lisa, and Lisa will work out a little bit of a timetable and she'll give it to you in as much advance notice as possible. So hopefully then if you did need to take a week off from work or something like that, you would have enough notice to do so, um, if that's okay. So that's the way that it's worked in the past. There is a little bit of flexibility, so obviously sick days and things like that, but it is as much locked in as we can because we're working very closely with Lisa and she's been very kind to take all of you on, and there is quite a lot of you in this class. So changes are probably, like I said, we'll give them to you in as much notice, the dates in as much notice as possible. But if you're then trying to change, it may then affect someone else's placement as well.
Great. Any more questions at all?
Hi, Tracy. Yes, your work placement will happen after your first workshop. Um, which if you're in the February group, that's fine. We're probably not going to fit everyone in. Like I said, there's quite a large number of students in this particular group. So if for any reason that pushes us back to a point where you can't complete on time, you will get a course extension. But I think that if all the dates work out, everyone should fit their work placement in between February and their course end date. Fantastic. Well, if no one else has any questions, we might say a big thank you for Lisa for her time and her expertise. We really, really appreciate her coming in. If you've got any questions that are pathology specific over the next week or about work placement, you can always email them through to us here at the Allied Health team, and we can pass them on to Lisa, or we can save it for her next tutorial session. And other than that, some of you might have your first workshop coming up, and I'm sure that Lisa will talk a little bit more about work placement at that time as well. So beautiful. And we might all log off then. So I hope you all have a wonderful evening. Thank you again, Lisa. And we'll
Thanks,
see you all
guys.
next time.